Today on a special Your Life A to Z Health Show, we'll hear from doctors and experts on a variety of timely health issues.
Now, something called telemedicine is a rapidly developing application of clinical medicine. And here to explain how all this technology is being used at Phoenix Children's Hospital and how it all benefits the patients, of course, is Dr. David Bank and telemedicine design manager from Global Media Group, Neil Schoenbach. Thank you, Neil, for being here as well. You're over there, but we're going to talk with you in a second. I want to ask you first, Dr. Bank, what's telemedicine? When I heard it, I'm thinking, geez, it's so scientific and so out of the future.
And that's the problem. It's been around for 15, 20 years, but it's been a very unknown sort of entity. But it's really started to take off in the last 10 years. And basically, the leaders of it were the Mayo Clinic. They're the ones that started it. And now in the state of Arizona, we're seeing a whole bunch of usage of it. What it allows is it allows doctors to actually see patients in remote areas where they don't have access to specialists or doctors.
I see.
So you can now the technology has got us to a point where it's very easy for a physician to actually talk to and examine a patient remotely and do a full examination at their laptop.
Wow, that's pretty cool. So that's great for people who live in remote areas. They need to see a specialist especially, get it, and they can help them see it.
Yeah.
Neil, why don't you kind of show us, to kind of give you an idea of how this all works, because you think, well, to see a patient, you can describe it, you really need to see things for yourself as a doctor. And you can look in ears, throats, all sorts of things, right?
Yeah, you really can. Global Media is based here in Scottsdale, Arizona, and this is one of the devices that we manufacture. It's the total exam camera, and it allows you to capture images, and I'll show it here on the screen, of your eye.
Oh, I see. So now you can take this image, Dr. Bank, in Phoenix, and let's say Neil is in, I don't know, some other remote part of the state, and you can actually get an idea. So instead of him going, it's red and it looks like there's a bump here, you can actually see it.
Yeah, so really the way this is working is this unit is actually in the remote area.
Right.
And you can train a layperson to use this equipment. You don't have to have a medical school degree or a nursing degree to know how to use the ear scope and the lights. So at the site where the patient is, this is where that unit is, and I'm at a laptop at Phoenix Children's, for example, or in the Mayo situation in Mayo, and I can basically ask the patient or whoever's helping the patient to show me their eye, to show me their ears, to show me their throat, to put the stethoscope on their chest, and I'll have an ear set and I can listen to them. Wow. So it's really, I think, especially with all this healthcare reform going on and access to care and all the overutilizations of urgent cares and ERs, this is going to be the next phase in being able to screen people as to whether they need emergent care and actually to provide routine care for people who are in remote areas. We're setting up this program at Phoenix Children's. We're at the beginning of it, with some gated communities that are very far away from Phoenix Children's Hospital. So if a child falls down and they have a cut and they don't know if they have to go to an urgent care, they can show me the cut. Okay? Wow. So it's really fascinating. It's very exciting. I don't know if Neil can
Neil,
show.
I see you've got the tongue depressor thing there too, which is great because I think maybe how were things being done in the past? They would just describe things to you or maybe even take a picture. But look, you can get inside his throat. And it looks good there, Neil. I don't know, Dr. Bank, look at, you can really, so if there was something internal, you can see that as well.
I would not do a strep swab on that. That's
really?
okay.
You can tell by the picture.
Looks like Neil might snore a little bit, but you don't, do you? Okay.
We can ask my wife.
Right.
But that's interesting. He could tell right then if you should go to the next step.
These images are actually better than sometimes what we can see in person.
Wow.
Because they're being magnified at such high resolution, especially the ears, okay, that, you can capture it on a picture, and if I don't know whether the ear's infected or the throat's infected, I can actually capture it and I can send it to an ENT specialist.
And we're looking at your ear right now. Well, that's neat, too, because you can look at it and say, you know what, Neil? I'm concerned, so now I'm going to send this image. What did we just see there, Neil?
I'm trying to get it good view for everybody.
Oh, wow.
So you can see inside the ear really well.
Yeah.
Looks good, huh?
Yeah, that looks clear to me. That looks like you could hear through that. Yeah, you can see the bone behind it and nice clear eardrum. So, again, the utilization of this is just phenomenal. I think there's going to be a day, this is going to continue to take off, where we can actually serve populations of patients that will never have an ENT doctor or a dermatologist or a pulmonologist in their communities and actually serve the same quality of care that we provide for those that are close to major medical centers. centers.
So Neil, can anybody get this technology so that they can go ahead and commute or talk with doctors from different areas?
Really, we're seeing a huge taking across the country, from the VA hospital system down to just critical access hospitals, as you mentioned, in rural areas where they don't have a neurologist or a cardiologist, that now they can have those specialty services in their backyard.
Very interesting. What about taking it from a patient that you have at Phoenix Children's and maybe teleconferencing with somebody in New York if it's a very unique case?
Absolutely doable. Well, the way we're going to use this at Phoenix Children's is we're going to be receiving a lot of images and giving advice, but we also want to use this cart as a vehicle to actually, for kids that are in the ER or urgent cares, to actually communicate with our specialists who might be at home or might be in the middle of a busy clinic. They can't come over physically and see a kid, and basically they can look from their laptop and give us some advice on what kind of cream we need or whether we need antibiotics. So it really works both ways. One of the things that Global Media did with the Children's Hospital in Cincinnati, which is fascinating, is they actually developed a device that could be hooked onto the stretcher of a bed or the stretcher, so that the doctors at Cincinnati Children's could actually start to give advice and care as soon as the patient was brought onto the stretcher from a car accident or from a fall.
Wow.
And they're seeing the patient for the 20 minutes that the patient's being transported to the hospital.
And they're getting their plan ready, so the minute he walks in the door,
they know exactly what's going on.
It's very interesting.
It's
great technology, and it sounds like it's really going to start cutting out unnecessary visits and a lot of extra expense, because you can say, you know what, this is okay, you're good, if you're all the way in, let's say, Window Rock, to travel all the way to Phoenix Children's, where you don't even need to, because you can say, you know what, I think you're all right. Just
I can't tell you how many calls we get from remote areas or 2-4 hours away about, I don't know if this kid really needs to go to you. Well, we can save that trip and the expense of a $5,000 helicopter bill for a transport, for example.
Exactly.
So,
very good.
Yeah.
Very futuristic, but it's here today. This is great. Thank you so much, Neil, for explaining. Thank you for being our patient today, too.
Thanks for having me.
Glad to see everything is looking good. Thanks, Dr. Peng.